The Industrial Revolution took place from 18th century to 19th century. The Industrial Revolution changed the society completely. Before the revolution, many people lived in the villages and worked in agriculture or as skilled craftsmen. They often did everything by hand. The new enclosure laws made many poor farmers bankrupt and left them unemployed. It forced them to work at factories. They now had to move into cities to be closer to their jobs. As the cities became more populated, so the problems got worse, like diseases. Disease was a constant threat during the Industrial Revolution. Changes in the way that people lived and conditions in which they worked led to disease being able to spread much more rapidly, and new forms of disease emerged that were as deadly as any killer that had been before. Towns grew very quickly as factories led to immigrations from the countryside. As the demand for housing increased so rapidly, the quality of homes constructed was low. Housing for the worker was cramped and built quickly and built with little regard for hygiene. In many cities, the result was that large slums appeared. These slums were areas where houses were small, roads narrow, and services such as rubbish collection, sewage works, and basic washing facilities non-existent. In this type of climate, bacteria grow quickly. The water supply is likely to become infected, and weaker people are likely to fall ill much more rapidly. Water was often the problem. Factories would dump waste into streams and rivers. The same streams and rivers used to supply homes with water for washing and cooking. Soon people's health was in danger. In many slums, the same water supply was infected with human sewage, as toilet facilities were often inadequate and sometimes consisted of a toilet block that was emptied irregularly, meaning that when it rained, the waste may overflow into the gutter and therefore into rivers and streams. The result of this is the spread of disease. One of the main killers of the Industrial Age was cholera. The deadly disease was waterborne and spread through filthy cities with ease and killing thousands. Typhoid also took a hold in some areas and made great use of poor sewage provisions to take a hold of many areas. Diseases such as cholera and typhoid are now fairly easily prevented. Basic cleanliness, underground sewage pipes, and regularly cleaned and controlled water supplies doing most of the work to prevent any reoccurrence of this form of disease. In an age where ordinary man had no political say, however, and no money or even education to support a claim for improved conditions, the issue was often overlooked. These diseases rarely worried the wealthy. There was always another worker available to replace those who died, and many. So why should they concern themselves with issues such as health of the poor? Thankfully, some of the great industrialists of the time did see a worth in tackling the problem, and there were a number of reports and recommendations made into prevention of the disease and improving hygiene. One of them were Edwin Chadwick. In 1849, he persuaded the authorities in London to clean up the sewers in their districts. Each week, an estimated 6,000 cubic yards of filth swept into the River Thames. This caused major problems in the cities, because it was causing cholera and typhoid. The Industrial Age also saw the advent of new forms of science and medical advances. This to aid the fight against killers such as cholera and typhoid. Later these improvements were taken. Health Acts were passed so that the health problems were no longer any issue. Louis Pasteur, a French chemist and microbiologist. He was the first one to discover in 1870 that microbes resulted in diseases, and also he was the first one to create the vaccine for rabies. He was best known to the general public for inventing a method to stop milk and wine from causing thickness. This process is called pasteurization. Alexander Fleming was the scientist who was working on Staphylococcus. These are the germs that make wounds go septic. While cleaning the dishes, he saw a mold growing on one of the plates. He thought that was unusual, and he started growing more mold and started experimenting on them. He found out that they reacted to anthrax and diphtheria without creating any harmful side effects. This was the first occasion that an antibiotic drug had been developed. The new drug was a member of Penicillium notatum family, known popularly as penicillin.